to Breakfast with Spaniels with Dr. Judy Morgan.
Giving me a chat box. Go Facebook. Not giving me any comments. Oh well. Can't see a darn thing. How weird.
Remember, you can purchase all of Dr. Morgan's products at her website.
Well, good morning, everyone.
www.drjudymorgan.com.
I can't see who's on. I don't know why it's not giving me anything.
Sit back, relax, and enjoy the show.
How very weird. You know what? There's a new glitch every day. Okay, so I wanted to talk quickly about pain medication because I saw something in a Cavalier post about a little dog with SM, and the veterinarian keeps upping the gabapentin and upping the gabapentin and upping the gabapentin, and now they're saying the gabapentin's not working and the dog is worse, and I'm not sure what the symptoms are that are worse, but they want to put the dog on steroids. And so, of course, the owner's very distraught, doesn't want to go to steroids, and so I thought, well, let's talk about gabapentin in particular, but I'm going to talk about another one as well. So I'm going to start with Tramadol. Tramadol is a synthetic opioid, so it's not a natural compound, it is synthetic, and it's an analog of codeine, which means it's related to codeine. Species differences. It works really well in humans, it works really well in cats. Dogs, not so much, and I think it's very much overused for dogs. Has a lot of side effects as far as sedation, nausea, constipation, a lot of things that we can see with it, but it's actually not that effective. Only about 60% of dogs will get any benefit from Tramadol, and it's because they have different pathways to metabolize the drug, and dogs just don't do it as well. Okay. I'm looking at some notes here from my pain class so that I make sure I get this right. Okay. Cats are sensitive to the side effects of Tramadol. So we don't use Tramadol very much in cats because the side effects are a problem for them. And it can make them act really weird. It can cause some psychologic effects for them, and it's really bitter. Tramadol is really bitter, so I've used it a couple times for our dogs in the past for breakthrough pain, and if they find it in the bowl, they are not going to eat it. If you're trying to get it down, you've got to hide it in something, so it generally needs to be in a capsule, particularly for cats. Coat it with butter or oil to get it down. For dogs, we almost always have it in a tablet, but it is bitter, bitter, bitter if you've ever tasted it. And dosing for dogs is recommended every 8 to 12 hours. For kitty cats, you really only want to give it once a day if you're going to use it at all, because the side effects are pretty horrendous. So in dogs, it's really unreliable at producing pain relief. There's no role for it in acute pain, and it may only last 4 to 6 hours. Should not be used by itself for pain med. It's used in combination with other pain meds. And in chronic use, it may enhance its own metabolism, resulting in lower blood levels, meaning if you're using it chronically, you may have to increase your doses to get the same benefits from it. Okay, and then I want to talk about... and interestingly, we want to be very careful if we're using pain medications, if we're using herbals as well, to make sure that things don't react. For instance, St. John's wort will interfere with some of these medications. So we want to talk about. Let me find my gabapentin. Here it is. All right, so gabapentin is used for neuropathic pain, which is why we use it so much in dogs with SM and CM, because that's a neurologic problem. The pain is coming from the brain and spinal cord and the nerve endings, and that's where this drug works. That's too complicated. By itself, it does not produce pain relief. Okay, and it's again should be used as part of a multimodal program, so you're going to be using multiple things together. But what it does, it prevents pain signals from reaching the upper part of the spinal cord. It is very effective because it's not metabolized by the liver or kidney, but it is eliminated through the kidneys. So if you have a dog with decreased kidney function, you may have to lower your doses because they're going to accumulate more of the drug and its metabolites in their bloodstream because they're not eliminating it as quickly. But it does not cause liver or kidney problems. So that's a good thing about the drug. I've never seen changes in kidney or liver function from gabapentin usage. Major side effect with gabapentin is sedation, dizziness, drunken walk, called ataxia. Some dogs can get like really loopy with it. And what's really interesting, and this is the what I really wanted to speak to, because this is the person that was on this Facebook feed. The dog seems to be getting worse, whatever that is, and they keep increasing the meds. Well, in dogs with pre-existing neurologic weakness, and we're not talking pain and the scratching and the rolling and the screaming and pain. We're talking weakness. So they're down in the back end. They're getting weaker and weaker. The gabapentin may make that worse. So you actually want to decrease the dose of the gabapentin or stop it. And gabapentin, if they've been on for less than 2 weeks, you can just stop the drug. If they've been on it for a long period of time, you should wean them off of the drug. And I have in my notes, you appear very wise when you decrease the gabapentin and the dog has a much easier time getting up and walking. So we have taken all of our dogs off of gabapentin. Shayna was getting so weak, she couldn't get up. She was having a lot of trouble. And now that she's off it, she's much better. Of course, we upped her dose of CBD. She's on the PEA. She's on the UC2. We're using a lot of other things to keep her moving. Okay. Gabapentin is useful for its sedative and anti-anxiety effects. So a lot of veterinary hospitals are now using gabapentin for cats that come in the hospital that are really flaked out, and they're prescribing it for people to give. Usually we use it as a liquid in the kitty cats to give before you need to get your cat in the carrier, before you need to bring your cat into the office, because it makes them pretty chill and allows them to have a much easier time during the visit. So if you're using gabapentin, you need to adjust to a dose that works. If the animal is too sleepy or seems to be very weak, then you want to decrease that dose. Don't keep increasing because the dog's going to get worse and worse and worse. You really should not use gabapentin chronically 3 times a day. Twice a day is really enough for 99% of them. And then I have in my notes that, let's see, the pregabalin, which is the Lyrica, which if dogs aren't responding to gabapentin, a lot of times the veterinarians will move up to pregabalin. It's longer acting, but it's a lot more expensive. And she has in her notes question, is it worth it? Okay. There is no strong evidence of a perioperative pain effect of gabapentin in dogs and cats. It should not be used as the sole pain med to manage perioperative pain, and I don't see that in notes from clinics. There are 2 studies examining the use of gabapentin in managing chronic pain. One study suggested a modest effect in dogs with neuropathic pain secondary to CM, the Chiari malformation, when combined with carprofen, which is Rimadyl. one case report exists examining the use of gabapentin as a pain med in dogs with chronic neuropathic pain. Therefore, the data supporting use of gabapentin in chronic pain, even neuropathic pain, is extremely limited. So we've been using it for a long time, but we don't have a lot of really good studies behind it. I think it is effective, but it does need to be used correctly. Okay, hope that helps some of you. I am really sorry that I cannot comment on anything. I have no idea why the Facebook gods decided I should not see any comments today. So, is what it is. I guess I'll have to go back in later if I have time and look at your comments and try to reflect on those. It's very weird. Have a great day, everyone.